This is a story that came out in the Washington Free Beacon, January 3rd, 2018. Study: deaths from opioid hospitalization quadruple over 2 decades. And this story is hitting, hospital deaths from opioids soar. And it's mainly hitting rising mortality concentrated among elderly, white, and poor Americans. Deaths from opioid-driven hospitalizations quadrupled between 2000 and 2014. A new study concluded, painting a grim picture of the decades-long opioid plague that killed more than 42,000 Americans in 2016. The study, published in the December issue of Health Affairs, is the first nationally representative evaluation of opioid-driven mortality rates. Using data from hospitals nationwide, it concludes that the opioid-driven hospitalization mortality rose from 0.43% in the period between 1993 and 2000 to 2.02% in 2014, an average increase of 0.12% points per year, initially remaining constant between 1993 and 2000. The opioid-driven mortality rate doubled to about 1% between 2000 and 2007. It then doubled again between 2007 and 2014, meaning that the rate of increase in the rate has also grown. Today, about 7,000 people were treated in emergency rooms for opioid misuse each day. Wow, that's a lot of people every day. For comparison, the mortality of hospitalization due to other drugs remain unchanged over the 1993 to 2014 time period, while the mortality rate for all other hospitalizations actually decreased. In practice, that means that in 1993, the rate for all other hospitalizations was 5 times of the opioid-driven hospitalizations by 2014. Opioid-driven hospitalizations had outpaced all other hospitalizations. Over the study period, the number of admissions for opioid-related issues remained basically constant. What changed was the kind of issues. Specifically, hospitalizations for abuse declined by about 0.01 per 1,000 people per year, while hospitalizations for overdose and drug poisoning rose at the same rate. Today, drug poisoning is the leading cause of injury death in the United States, outpacing homicide, suicide, and car accidents. The increase in opioid hospitalization mortality proves further evidence that although it has only recently achieved public attention, the opioid plague has been quietly devastating American communities for the better part of the past 20 years. That's a damn shame for a drug plague to be going on for 20 years. One recent study determined that the rate of the opioid abuse, approximately 13% of Americans over age 12 admitted to abusing opioids at some point in their life, was in fact constant between 2003 and at least 2014. The study also reveals the communities disproportionately struck by opioid addiction and related deaths disproportionately high and fast-growing rates of opioid-driven hospitalizations occurred, in patients ages 50 to 64. Wow. White patients, patients in the lowest income, patients in the Northeast. Among older Americans, Medicare recipients were particularly hard hit. Medicare beneficiaries went from the smallest portion of these hospitalizations in the 1990s to the largest share by the mid 2000s. Wow. Study author Dr. Zaru Sung, an assistant professor of healthcare policy at Harvard and a physician at Massachusetts General Hospital, suggested three potential underlying causes for the rise in mortality. There were the frequency with which less severe cases were being treated in the field using overdose reversing medication like naloxone, the rise in the cost of prescription drug versus the cheaper but deadlier heroin, and the proliferation of power synthetic opioids like fentanyl. The leading culprit in overdose deaths in 2016, until community-based efforts to tackle opioid misuse have taken root, treating opioid addiction and better equipping hospitals to care for patients with increasingly severe opioid abuse may help the healthcare system combat the rising mortality rates of patients hospitalized for opioid use disorders, Song wrote. The opioid plague remains a serious public health issue. Most recently, the CDC determined the plague to be largely responsible for the 2-year decline in U.S. life expectancy, the first such year-on-year decline since 1962-63. Well, there you go. More and more people are dying in the hospital from opioid overdose, and these people are between the ages mainly 50 to 64. The biggest concentration are among the elderly, white, and poor Americans. So there you go, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on that notification bell twice. And also join me over on Black Junction TV and also blackspot.com. Peace, family.